All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. My apologies for being a little late. So, with me today, I have a doctor that has been going viral about Alzheimer's. So, of course, we requested that please come and discuss with our cool beans as well if there is Alzheimer's reversibility. So, Dr. Josh Hellman is with us today. So, Dr. Hellman, welcome.
Thanks. It's great to be here, Dr. Bean. And I've met you in person, and it's cool to be doing this together.
Awesome. And so, for our audience's benefit, tell us a little bit about yourself.
Sure. And my background is I've got 2 degrees in biochemistry, 2 degrees from Harvard, and I've got a very strong background in traditional medicine, double board certified in emergency medicine, lifestyle medicine. But I think more important than all that is when I was a teenager, my grandmother, Eileen, developed Alzheimer's. And so I saw firsthand the effect that had on not just her, but also on my own parents, because I could see them worried. Hey, this is happening to Grandma Eileen right now. What's going to happen to us in 20 or 30 years? So just from a very early age, I was like, this Alzheimer's, this brain problem it's a huge problem. And I was studying biochemistry as a nerd, as a 17-year-old. I was studying biochemistry, and I was like, hopefully someday the answers will be here. And the cool thing is 30, 40 years later, the basic things I learned about biochemistry at Harvard and elsewhere, I've been able to put that in practice to help patients prevent and reverse Alzheimer's. And that's my biggest message, is that there is hope. Because when I studied this at Harvard, it was basically you could only diagnose Alzheimer's on autopsy after the patient died. And number 2, there's really nothing you can do about it. And it's just in the last 30 years, it's a completely different field now. But the key is to get the word out to as many people as possible, because many doctors don't even know this yet.
And this is very important because my grandmother, my maternal side, my mother's mother, she had dementia and Alzheimer's as well. And so I think very often that eventually I'm going to develop dementia as well. So number one, thank you very much for being here. You are not only hope for the cool beans, but for me as well. And the second thing is, yeah, when I was reading pathology and clinical medicine 30 years ago, I also thought this is not a reversible disease. It is a progressive disease, and maybe you can stall it a little bit, but there is really no hope. So this is an amazing discussion today. Thank you very much. This is a great time today as well for all of us to learn this from you. So my question to you, when you say Alzheimer's is reversible, so I want to ask this question in 2 parts. Number 1, can we prevent or stall Alzheimer from occurring? And number 2, then, why is it reversible? The medicine doesn't say it that way.
Right. So let's start. So when I'm talking about Alzheimer's, in the United States at least, about 70% of adults with dementia, it turns out, that causes Alzheimer's. But we know a lot more about Alzheimer's today. We know, for example, that people can actually, it can actually take 30 years of brain damage to develop Alzheimer's. That's number 1. And number 2, the first 20 of those 30 years, people may not be symptomatic at all. So I think it's so cool that we have an audience here, because Alzheimer's and dementia are reversible. Now, let's dive deep in there. It turns out every case, or many cases, of Alzheimer's, there are between 30 and 200 root causes. Let me repeat that. Between 30 and 200 root causes. This is not a simple disease where it's just one thing and we're going to find one drug or one operation that's going to fix everything. This is complicated. It's nuanced. In every case, there are different amounts of these 30 to 200 root causes. So basically, one reason why it's taken so long to figure this out is that it's complicated. Sure, we could talk about things like amyloid plaque in the brain and tau tangles in the brain, and yes, they are definitely associated with Alzheimer's. But then the question is, okay, but what's causing these amyloid plaques or tau tangles, and how can we prevent them or reverse them once they show up?
So thank you very much. For our viewers' benefit, there's a question here from M. Gregory. What is the main difference between dementia and Alzheimer's? So maybe we can go back to the basics for a second.
Sure.
What is dementia? Then what is Alzheimer's? And then we go back towards the reversal.
Sure. So dementia is a very broad term. It means basically something in the brain is not working. And we're not just talking about memory here. We're also talking about the brain being able to process information and emotions. Of course, emotions are also processed throughout the brain. And that's one of the exciting things, is that often when I'm reversing Alzheimer's, the first thing that comes back isn't the memory, but the emotions and being able to interact with other family members and friends. So again, but what again is dementia? Dementia is just a term for something in the brain is not working. Now, it turns out 70% of the cases, in adults, it turns out to be Alzheimer's. What's the other 30%? Things like if you fall and hit your head, you have head trauma, you might have a blood clot in your brain. If we remove that blood clot, often your thinking will get better. That's one example of dementia that's not Alzheimer's. Another one is, let's say you have a brain tumor. Let's say you've got brain cancer. If we're somehow able to treat the cancer, get rid of the brain cancer, your thinking, your brain will start working again. Those are two examples of dementia that are not Alzheimer's.
Understood. Thank you very much. So that means that there's, for example, there's a question. We're still in the definition area of the Alzheimer's.
Sure.
There's a question that is, so ZX82 says, what if the patient's brain is shrinking? Is it still reversible? I guess your answer is going to be depends, but what do you think?
Yeah, I think it is reversible, but you need to have buy-in from the patient. For example, it could be the reason that their brain is shrinking is they're abusing alcohol. And alcohol is an addictive substance. You have to work with them to get it off, to remove it. And once you take the alcohol toxin away, then there are specific things we can do to help regenerate the brain, whether it's exercise or some of these regenerative strategies like exosomes, etc.
Understood. So thank you very much. Now back to the discussion of the Alzheimer's and its reversal. So let me ask, first of all, when you say it is reversible, what is your experience? Have you had patients whose Alzheimer's have been reversed? You made a statement that when I'm reversing. So
Right.
what is your own experience first? And then we talk about what first of all causes Alzheimer's and then how do we reverse it? So
Sure.
what is your experience?
Yeah, so my experience, I've been reversing Alzheimer's for over 6 years. So this is not a theoretical discussion of maybe someday we'll have this. I've actually been doing it with patients for 6 years, and that's why I'm saying there's hope. But the good news, it's not just me in my practice. There are published studies. Dean Ornish published a study last year, a group of patients with Alzheimer's. He was able to reverse their Alzheimer's with lifestyle. And when I say lifestyle, meaning changing what they're eating, getting them to exercise, decreasing their stress, things like that.
Understood. So let's then get into the lifestyle. What is it that I am doing and my fellow people are doing that predispose us towards accelerated or Alzheimer's compared to somebody else?
Sure. So it turns out analyzing the data, and I know you've also trained at MIT like myself, analyzing the data from thousands of patients with Alzheimer's, it turns out that the number one largest risk factor for developing Alzheimer's turns out to be not enough sleep, deep N3 sleep. And what's going on there is when we have the deep sleep, our brains are able to clear out the amyloid and also consolidate the memory. So it's not the case that, oh, well, I sleep, I'm in bed 8 hours a night, therefore I'm getting N3 sleep. No, if you're a very light sleeper, you may not even be getting down to this N3 deep sleep that's very important. And it turns out the older we get, on average, we're getting less and less N3 deep sleep. For example, the average 20-year-old out there is getting 2 hours of N3 deep sleep, as opposed to the average 65-year-old is only getting 30 minutes and a night. And then by the time they reach 80 years old, we're down to 15 minutes of N3 deep sleep. And this is important because for every percent loss of N3 deep sleep, your risk of getting Alzheimer's goes up by 22%.
Understood. So sleep is one. I'm sure that there are food habits as well that you might allude to. One question that I want to ask is, how do I know that I have a beginning of dementia or Alzheimer's? Are there any early signs for this?
Sure, there are many different signs because the brain is so complicated and does so many different things. You're looking for a change in the pattern. So, for example, Dr. Bean, if you never could find your keys and you're still having trouble finding your keys, no, that I wouldn't be worried about that. But if this is a new thing, we're looking for changes, even subtle changes. We're looking for repetition. Like if you were asking me the same question over and over again, which you're not, but if you were, I'd be worried. I'm worried about that, Dr. Bean. And then changes in behavior. So, and I'm not saying that everyone who becomes anxious is getting Alzheimer's or dementia, but it's one of the possible signs of early dementia if there's emotional changes like that.
Understood. Thank you very much for that. So, with those early signs, what food? So, for example, there is a question here that is diabetes connected to Alzheimer's as well? So, I would consider diabetes to insulin resistance, and before that, glucose and and lipid toxicities. So, are there some specific foods or food categories that accelerate or make us vulnerable to dementia?
True. So you want to stay away from processed foods. You want to stay away from foods that are high in added salt, oil, and sugar, because those types of foods often have added toxins and will specifically do damage to blood vessels. And you can imagine the brain is a very vascular organ. If you do damage to the blood vessels in your brain, there's potential damage there. The other thing is, if you get a blockage of your carotid or vertebral arteries that go from the heart to the brain, it's going to be very difficult for your brain to work if it's not getting the oxygen and other nutrients. So for that reason, I advise people to stay away as much as possible from processed foods that are made in factories, and to stay away from foods that have added salt, oil, and sugar.
Understood. So the type 2 diabetes, for example, here's this question, Karen
Sure.
says, is there a correlation between type 2 diabetes and Alzheimer's? So that is also related to the blood vascular damage and then the neurological damage?
True. And then the other piece from Karen's question here is that type 2 diabetes, when it involves the brain, has also been called type 3 diabetes because it's so common. And why is it such an association? Number one, with diabetes, you get high insulin levels, and that contributes metabolically to dysfunction in the brain. But also, if you can imagine that you have uncontrolled blood sugar, your blood is sweeter than it's designed to be. And then what happens is it's almost like caramelization. You get these toxins called AGEs, which are advanced glycation end products. And it's almost as if your tissues, your brains, are being caramelized. The proteins are actually getting added glucose molecules to them, and that's often leading to brain dysfunction. So it's complicated, but the bottom line is, one of the important reasons why you want to control your blood sugar, and hopefully, if you have type 2 diabetes, reverse it, is so that to minimize the impact that has on your brain.
So I'm going to ask you one more question, which is for me very interesting, and I see a commenter here as well. The long COVID or vaccine adverse effects, especially the long COVID, for example, uh, may end up causing mitochondrial damage. Even vaccine can do that, and blood-brain barrier compromise, tumor necrosis factor alpha production, which would then cause the inflammation of the brain, spike protein damage directly. So the question is, have you seen, or is there a possibility of long COVID or long vaccine adverse effects to actually start tipping patients towards dementia and Alzheimer's?
True. I've definitely seen this both before and after COVID and the vaccine. You're exactly right. The the COVID vaccine and COVID itself, you're dealing with toxins, specifically the spike protein, that will do damage throughout the body, including the brain. But what's interesting is, as I explained in the beginning, normally you're looking for between 30 and 200 root causes. So with the vaccine, sure, the spike proteins are toxic. The adjuvant agents, whether it's heavy metals or aluminum that are toxic to the brain, it's all in addition. But I can assure you, I was treating patients with brain injury before COVID, and this the COVID and the vaccine just added another layer. It made it's much more likely for people who already have high levels of heavy metals and plastics and pesticides and forever chemicals. For those people, once you add in the COVID virus spike protein and or the adjuvants with the vaccine, they're much more likely to end up with brain damage. So I think long COVID, it's on the continuum or spectrum. I think it's related.
Absolutely. And there was a study from UK where they said that even somebody who had mild COVID, not long COVID, just the mild COVID, a year later, some of the people who died and then they took their brain samples, they had up to, I believe, 5 to 10% shrinkage, global brain mass shrinkage compared to those who did not have COVID. So this actually, mild COVID can do that. Imagine what long COVID or spike protein in general can do. So,
Uh,
sorry, please go ahead.
I was just going to say, but I think people are more likely to get this long COVID syndrome if they're already dealing with underlying toxins and other infections. So, for example, if they already had Bartonella in the brain or the Lyme spirochete in the brain or CMV or other viruses, this just adds to the fire because we know the number one risk factor, excuse me, not the number one, but one of the common pathways to the development of Alzheimer's is inflammation. And all the things we're talking about will increase your immune system's response and basically the fire that's going on in people's brains with Alzheimer's.
Understood. So, with this context for Alzheimer and getting a bit scared about it, tell us what can we do to start reversing it if we are developing those? Are there any kitchen ingredients that you would recommend that we do not use or use to start reversing this disease?
Yeah, so it's interesting. One of the preparations I normally recommend, both for cooking and for taking as a supplement to improve brain function, are lion's mane mushroom. There's a study done of uh, elderly with Alzheimer's. They were able to reverse their Alzheimer's in 49 weeks using 1,000 milligrams a day of lion's mane. So that's one of the ingredients I'm a fan of. I've also seen good data and had good clinical experience with rosemary essential oil. But I'm sure cooking with rosemary would also be advantageous because there's specific compounds in the rosemary that help the brain.
Understood. And sorry, I was typing as well for people's
Okay.
benefit. So, so these are the some of the ingredients and supplements. Uh, you have a protocol to reverse Alzheimer's. So, other than people finding you, and for finding, there was a comment that what is Dr. Josh's complete name? So, Dr. Josh Hanman is the complete name. I typed it out in the comments as well. You can
Thank you.
find him. So other than finding you, uh, what is the protocol?
Yeah, so here are some, because we're dealing with so many root causes, here are some of the treatments that I've found that have worked for reversing Alzheimer's. There's, as an example, at least in the United States, there's an FDA approved drug for compassionate use that decreases inflammation of the brain by going after lectins in the brain, specifically galectin 3. Now, your viewers and listeners may have heard of lectins in vegetables or plants. It turns out that we as humans, we make our own lectins as part of our immune system. And what we're finding is that in many chronic diseases, including in Alzheimer's, patients will have increased levels of galectin 3, a type of lectin that is released by macrophages in the brain. And macrophages are part of the immune system. They look kind of like Pac-Man. And what galectin 3 does is it revs up your immune system. What this new drug for compassionate use does is an antibody against galectin 3. And I'm having some amazing clinical results so far in terms of reversing the Alzheimer's. It's one IV dose a month for 6 months. I'm seeing good results just with that simple therapy, and it's really exciting to me. And the cool thing is we're not seeing any side effects that you'll often see with antibodies against amyloid that you may have heard out there. So and really no one's heard about this drug. So that's another reason to talk about it, is to let people know there's hope. In my hands, I'm seeing this. But to answer your question, often it's not just this one drug. It's a whole series. You layer, you find out what the root causes are, you treat specifically those, and you layer these on. And it's not just lifestyle or this new FDA approved drug for compassionate use. It's also, if I find you have high levels of toxins, what I may do for you is a therapy called total plasma exchange, which goes back over 50 years, where we basically, it's a form of dialysis. We take blood out of one arm, get rid of it because there are toxins, fatty toxins in it. And then in the other arm, we put back in albumin, which is just a normal human protein. So, and
Understood.
then, yeah, and then
Yeah, please.
other approaches. The important thing is you want to do detoxification first, because let's say you happen to have infections, parasites, biofilm in your brain and elsewhere. If I give you antibiotics that go after mold or other infections, and I'm not doing detoxification first, I could actually make you worse. And you only need to be burned as a physician once, when you're like, oh well, I'm supposed to be helping this person and now they can't walk. That only you only need to see that once, and it's like, no, I'm very cautious. I go low and slow, and that's why what I would suggest, if there's anyone watching this with mild or advanced Alzheimer's, is don't try to do this yourself. Find an expert like myself, because unfortunately, you can actually make things worse if you start stirring the pot. And it really is a pot of all these different toxins, infections, and other issues.
Understood. And that's a very good advice, to find an expert. And of course, who better than to find you as well? And for the viewers, I have no strings attached. There is no fee commission going on to say you'll get the patients and I'll get the money. This is just
No.
my normal service that I do, that I bring experts in various areas. So I have a question. The habits, what habits can we start adapting to start reducing the risk of dementia?
Sure. So one habit that would be amazing, if you're not already doing it, is exercise. I would say the goal should be every day. But everyone out there is in a different state. So there's some people who do no exercise. If you do no exercise, start slow, start 5 minutes a day. Now, if you're already exercising an hour a day, yeah, maybe bump it up a little bit. Now, I think it's possible to overdo it. I don't know that more than 2 or 3 hours a day of exercise is going to be beneficial. But to me, one of the biggest opportunities is exercise, because when we exercise, our brains release a factor called BDNF, brain-derived neurotrophic growth factor. And what this growth factor does is it stimulates, number one, new neuron growth, and then number two, synapses, the connections of the neurons. It encourages new ones. So to my mind, I would be trying to do exercise every single day.
Understood. And sleep,
Sleep is
right?
I would do first, and that's a complicated one because there are many different issues, reasons. You might have obstructive sleep apnea. There are sleep specialists that can help diagnose that for you.
So I have a very interesting question for you. I think you'll appreciate it. Those individuals who are taking sleep medication to sleep, the effect of sleep, is that the same effect as natural deep sleep?
Yes, and actually just had a video go viral on this topic, and it was covered in the Daily Mail of all places. But what happens is, if let's say you're taking Benadryl, which is an antihistamine anticholinergic to get to sleep every night. So unfortunately, Benadryl will help you get to sleep, but you're not going to get to the deep N3 sleep, which is restorative in terms of removing the amyloid and helping consolidate memories. So I don't recommend people take histamine or anticholinergics every day because unfortunately it it interferes with the good sleep and is a risk factor for developing dementia.
Understood. Thank you very much. Two more questions. Of course, there are many questions here, but two more questions at least.
Okay.
One question is that, is there any benefit of sauna usage for Alzheimer's?
And the answer is yes, definitely. And the more sauna, the better. And I think the reason sauna is effective is a couple. Number one, when you're obviously in a sauna, it's a hot environment. There are heat shock proteins in the body, including in the brain, that help rejuvenate the brain. And I think by going in the sauna, you are stimulating those. That's number one. Number two, when you go into a sauna, you're sweating. And when you're sweating, you're moving toxins out. And I'm seeing that many of these cases of Alzheimer's, toxins are one piece of it. So I'm a big fan of sauna, and the more the better. If you can do it every day, that's amazing. Here's another tip. I would prefer to do my sauna right before I go to sleep, because what triggers sleep is actually a cooling down of your temperature in your core. And you may be like, well, why is Dr. Josh saying get hot if you want to get cold? What's interesting is the brain is pretty smart. If once it goes into the sauna, it's like, hey, I don't want to get too hot. I'm going to cool my core temperature so that when you get out of the sauna, all of a sudden that thermostat, that cooling is still going on. So you get out of the sauna and suddenly, wow, your temperature's going way down, and that's a trigger to go to sleep.
That is an amazing thing. I mean, I could understand when you were saying it, but I had not heard of that before. So amazing. And I'm a mechanisms nerd. So thank you very much for bringing that up. The
Sure.
other question that I have is, how about there is the anti-tumor necrosis factor alpha therapy, which has been thought to be helpful for dementia as well. And I can connect it. I'm going to extend the techie pomps question by saying that I did a study where those people who had dementia already started, if they had in 6 months even one episode of systemic infection somewhere in the body, which produced tumor necrosis factor alpha, which would then go to brain, they had an accelerated dementia compared to others. So have you come across tumor necrosis factor alpha treatment and its efficacy for dementia?
Yeah, so I understand mechanistically how it will work. I haven't used it myself. I'm going after galectin-3, but from a conceptual standpoint, it makes perfect sense why turning down TNF would also bring down the amount of inflammation in the brain.
Absolutely.
I guess behind all this,
Absolutely.
I have to say every case is different. I worry that if you happen to have an infection in the brain and you're using anti-TNF therapy, that potentially you could be getting in the way of fighting those infections. But but in general, it's exciting. It's an exciting potential therapy.
So, my takeaway from the discussion so far, number one, we understood what is dementia and Alzheimer's, and then we saw what could be triggering it or accelerating it. And then there are possibilities to reverse it. You have been reversing it, and there are simple therapies to do that and lifestyle habits to do that. My question is, if this is this way, why isn't it mainstream? Why isn't big pharma talking about it? Why isn't the other doctors talking about it? What is going on?
Yeah, so I think this is a case of lack of education and information, and that's what I love about your show, because you are actually you're reaching millions of people with the education. I'll give you an example today. This morning, I saw a patient who was diagnosed with dementia, and her neurologist basically did standard tests, did a brain scan, simple labs, and documented that she wasn't thinking clearly, but basically told her to go home and not there's nothing else we can do. So I hate to say it, but in the United States at least, it seems like uh, the physician, many physicians, not all, many physicians and many neurologists are not like me trying to find cutting edge therapies to fix this. And you mentioned big pharma. I mean, big pharma has a couple new drugs that go after amyloid, and you think, oh, if amyloid's part of Alzheimer's, if we have antibodies against it, that should work. And it does work a little bit. Unfortunately, in a third of the patients, it causes brain bleed and brain swelling, because amyloid, it turns out, is a way that the body's responds to damage, and it's a healer. It'd be like if you cut yourself, and instead of being able to form a scab, if you constantly wiped it away, your wound on your hand would never heal. It's the same thing if you too rapidly try to get rid of the amyloid. In a third of the patients, they're seeing brain bleeding and brain swelling. So to answer your question, because there is no effective, safe, in my opinion, treatment from big pharma or surgical, I think that's why you haven't heard this. That's unfortunately that's the marketing apparatus. And I'm not opposed to medications or surgery when it's helpful, but the other thing we spent a lot of time talking about is lifestyle. Unfortunately, I mean, I'm board certified in lifestyle medicine, but that has not filtered into mainstream allopathic medicine yet. And you've got busy physicians, they don't have an extra hour or two or three to talk to their patients about getting adequate sleep and eating the right thing and decreasing stress and exercising. That's just not the current model.
Understood. Thank you very much. And thank you very much for this amazing discussion. Gives us hope, allows us to not only search you, but also search the solutions. So I have a few of it. One request is that I think we should do some more talks about this topic. Sure. And maybe go, one by one, or sleep discussion, and then a sauna discussion, and maybe drugs, various drugs and therapies. So if you like, I would love to invite you more times. That is one. And let me get. Okay, awesome. So we'll do some more talks about this. The second question I have is, if people are looking to find you, how do they find you? Where do they find you?
Sure. So people can find me a few different places. Number one, my website is very easy. It's just drjosh.com, drjosh.com. And my email address is drjosh, drjosh at drjosh.com. So that's number one. I've got a weekly podcast on reversing Alzheimer's, and you can find that on Apple or Spotify or at drjosh.com. And then on social media, you can find me at Green Brains MD, Green Brains with an S, MD. Because yes, I am an MD, like you.
Excellent. So this is great. And I have met you before as well, and I have had seen some of your presentations as well, and completely love the way you teach and the way you present. And Alzheimer's, as I told you, even I am scared of it. So this is a great news to see that there is possibility to stall it, regress it, reverse it. So thank you so much for that.
But
So
let me just focus on that hope here,
yes,
because specifically, some people out there genetically may have one or two copies of a gene like ApoE4, which puts you at an increased risk of Alzheimer's. The good news is if you do the right things when it comes to lifestyle, smart supplementation, your increased risk can be normalized. So the cool thing is, I think people want, I think people should seek out this information because you can actually do something with this information. If you're at increased risk, you can actually bring that risk back down to normal.
understood. So one more quick question. So Dennis says, if one is ApoE4 heterozygous, you brought it up, so I thought I'll ask this question as well.
Sure.
Should they see a functional neurologist?
And I think the answer is yes. The challenge is not all functional neurologists are the same. And I'm sharing with you information. I mean, I've got 2 degrees in biochemistry. I've been through the whole. I love the Bredesen protocol. I've been studying this and doing this for years and years and years. I know some amazing functional neurologists, and then I know some people just out of training who are chiropractors. I love some chiropractors, but again, I would, before you choose anyone, I would interview 2 or 3 people and see if they're actually doing what you're asking them to do, if that makes sense.
That definitely makes sense. So with this, Dr. Josh, any comments before we break for the next time? So any comments for the audience?
Yeah, so I would just summarize that number one, there's hope, that the biggest risk factor for Alzheimer's is not enough N3 deep sleep. So focus on your sleep. If you're worried, go see a sleep specialist. And then finally, inflammation is a common root cause. Do what you can to decrease the amount of inflammation and try to control your metabolism if you happen to be diabetic or have insulin resistance.
Perfect. Thank you very much. So once again, thank you from me. Here is another comment. Susan saying, thank you for this information. Bob is saying, thank you very much. So thank you for being here. Thank you for adding to the ambience of our neighborhood in this Cool Beans area. And I would love to have you more times with us.
I would love that. And thank you not only to you, Dr. Bean, and this platform, but thank you to the audience. And definitely share the information you learned today with your friends and family. We need to spread this information to everyone.
Awesome. So with this, Cool Beans, thank you very much from me and from Dr. Josh, and we would see you the next time. Bye for now.
Bye for now.